So the world is being progressively shut down by the coronavirus, which is rapidly spreading to every corner of the globe. But given its higher mortality rate compared to other viruses like swine flu, you need to be able to recognise the symptoms: runny nose, headaches, fever, muscle pains, fatigue, and racism. Yes, you heard correctly, the coronavirus is racist and it is discriminating against black people and other ethnic minorities. Not only are we seeing unprecedented levels of infection and spiking case numbers in several countries on the planet, most recently we've been seeing rapidly growing numbers in the US, we can now confirm that the only thing novel about coronavirus is the fact that it discriminates. In a recent article published on April the 8th by Afua Hirsch in The Guardian, the journalist asks the burning question that every health worker currently fighting the virus worldwide is too afraid to ask. If the coronavirus doesn't discriminate, how come black people are bearing the brunt? See, this is why journalists were listed as key workers by the governments across the globe during this pandemic, to really bring into the light these burning issues. Afua bases her whole article on a study that was conducted using information dating back from 2011, which of course she fails to mention because that wouldn't suit her narrative. Her article also echoes other pieces published by other newspapers such as the New York Times, which, after reaffirming that Brexit was purely the result of rising anti-immigrant sentiment, lectures us about how 8 UK doctors who have sadly passed away due to COVID-19 were all immigrants. Afua has also published many other articles that show how invested she is in the fight against colonialism, modern-day racism, and also how she fights for current social justice issues. For example, the playing the race card accusation is just a way to silence us. The manhandling of a blind man shows the Oxford Union still has a race problem. The struggle for equality is real. The woke police are a myth. In her article on how the coronavirus discriminates, Afra writes, "Government advice revealed its ignorance of how many people actually live. How do you self-isolate when you live in cramped or shared accommodation? How do you reduce shopping trips to once a week when you have little or no storage space? And if you do want to go to the park or do an extra shop, you now risk not only infection, but coming into contact with the police, some of whom are zealously taking advantage of their new social control powers." Well, how do you self-isolate when you live in cramped or shared accommodation?
Not well, bitch.
And that's the truth. In France and other countries like Italy, despite the spiking death rates, residents are managing to cope with lockdown orders and are staying put. Many of them living in small apartments with zero access to outside spaces, even balconies, but somehow they manage to cope. Because they realise that putting an end to the current pandemic and listening to their governments are in theirs and the public's interest, as opposed to reducing the crisis to a mere race issue. That includes not going to the park or doing an extra shop, as Afra writes. You can go out and exercise for 1 hour, and you should avoid extra trips to the shop because, honestly, even with social distancing, some people will ignore the rules and there's still a chance of infection. Yes, police have also been given new powers to deter people from unnecessarily venturing out into the great outdoors. And the Home Secretary has already ruled out giving forces any more new powers. She said checking trolleys is not appropriate and urged police to avoid heavy-handed law enforcement. But from the outset, we should also have been talking about race. Ethnic minority people are becoming victims of this frightening illness at an alarming rate. A study of more than 2,000 patients critically ill with the virus in England, Wales and Northern Ireland has found that 35% are black, Asian or other ethnic minority. This is more than double the representation in the wider population. What Afua doesn't mention is that the study in question, a report by the ICNARC, or Intensive Care National Audit and Research Centre, bases a large portion of its study, if not all of it, on the 2011 census. Channel 4 News writes, "On closer inspection, the data does not show that ethnic minority patients overall are 3 times more likely to need critical care for coronavirus than their white neighbours." Journalists have compared that 35% figure with the proportion of the UK population who said they belong to an ethnic minority in the 2011 census, 13%. But this is an unhelpful comparison. One thing we know about the coronavirus is that it is hitting urban areas, especially London, first and hardest. And these big cities are more likely to have larger BME populations. But it is possible that at least some of the apparent overrepresentation of black patients in critical care could be explained by wider demographic shifts in the places these individuals live. But nothing in the research these stories are based on supports the idea that BME patients face a risk 3 times higher than their white neighbours, once we account for the areas patients live. Compared to the makeup of council wards they live in, Compared to the makeup of council wards they live in, white coronavirus patients were slightly underrepresented in critical care. The proportion of Asian patients was in line with what local demography predicts. Black coronavirus patients were significantly overrepresented in ICU, according to these figures. It's true that BME people are more likely to live in urban areas and therefore more likely to have already been exposed to COVID-19. These are the places that have been hit first and hardest so far. As the news articles we have looked at made clear, more research in this area is needed. You know, I'll give Afua the benefit of the doubt in that she didn't see 2011 census and say that she probably just saw the study, skimmed through it and said to herself, meh. There's no equivalent data specifically for doctors, nurses and other health and public sector workers who have become critically ill, but, anecdotally, the picture looks extreme. The first 4 doctors who lost their lives as a result of treating COVID-19 patients in the UK were all Muslim men of African or Asian heritage. The important word here is anecdotally, which means based on personal accounts rather than facts. She even says it herself, there's no equivalent data specifically for doctors, nurses and other health and public sector workers. But you know, the picture looks extreme. How about some of the other health workers who have sadly lost their lives fighting this virus, such as Rebecca Mack, Amy O'Rourke or Liz Glanister? This may reflect the fact that the NHS has always been heavily dependent on ethnic minority staff, who today make up 40% of its workforce, more than double their proportion in the UK population. This may reflect the fact? No, it reflects the fact pure and simple, my darling Afua. If you look at official NHS statistics from March of last year, it shows that black and ethnic minority doctors, in particular senior and junior doctors, make up around 30% of NHS staff, with white men and women making up around 57%. It's therefore, and sadly, normal that as more healthcare professionals succumb to the virus, a higher proportion of those will be from black and ethnic minority backgrounds. It's worth remembering that statistic, given how little it's been reflected in much of the Clap for Carers campaign coverage. You have to go to some lengths, as national newspapers seem to have done when they dedicated their front pages to images of NHS staff, to make the health service look entirely white. These are the moments when we rightly applaud the immense heroism of health workers, but also build narratives about our society, about who serves, and about who deserves recognition. For the NHS to at that moment appear staffed only by white people is profoundly dishonest, a true whitewash. Well, I'm not sure about whitewashing, but here's some other photos featured on major publications. You see, this is what Afua has reduced me to, playing a game of spot the ethnic minority. But if Afua, who is so fond of cherry-picking data to suit her narrative, took a deeper look at those NHS statistics from March of 2019, she would see that in total, white men and women made up nearly 80% of the NHS workforce, as opposed to 10 and 6% for those coming from BME backgrounds. It's therefore normal that in a lot of photos where you have mostly nurses and other clinical assistants, you're going to see predominantly white people. It's also normal to assume that doctors, who have a higher chance of coming from BME backgrounds within the NHS, are probably inside the hospital, on the front lines, caring for those who have the virus. But I'm guessing that slipped your mind whilst you were skimming through photos of white NHS carers and getting all angry in front of your computer screen. As we have seen time and time again, when government policy claims to be race neutral, it ignores the fact that some groups need additional protection or support. Treating everyone the same can embed inequalities. In this case, the impact of austerity and economic meltdown on the charities and voluntary organisations that support local communities needs a targeted intervention. If government policy aims to be race neutral, that means that no special treatment or exceptions or specific procedures will be allocated or given on the grounds of race. Race neutral. Despite this, Afua then goes on to tell us that treating everyone the same can embed inequalities. Make up your mind, Afua. Racial disparities have a history, and it is no surprise to see a colonial mindset at work in much of the coronavirus response. From some of the early failure to take advice seriously when it came from East Asian countries, to the debate in France about testing new vaccines on Africans, a time-honoured practice in which black lives are valued less. COVID-19 has a way of drawing out the rot in our systems and exposing them. Oh, Afua, there is no colonial mindset at work. Regarding early failures when the virus was emerging in East Asian countries, the World Health Organization itself tweeted that preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. Since the emergence of COVID-19, we have seen instances of public stigmatization among specific populations and the rise of harmful stereotypes. Under the international health regulations, countries implementing additional health measures that significantly interfere with international traffic shall notify World Health Organization of the public health rationale of those measures within 48 hours. Oh, and look, the man running the WHO was actually a career politician who became its first non-doctor director general following intense lobbying from Beijing. They failed to properly warn us because a certain East Asian country lied about, manipulated, and destroyed data that could have helped the rest of the world realise the seriousness of the virus. And regarding the debate, well, the debate in France in reality was a debate on a news channel that included 2 doctors. It wasn't debated, discussed, or brought up by the French Prime Minister, President, or the legislature. It was simply a stupid statement brought up by a medical professional on television. But again, clarifying that wouldn't suit your narrative, would it? To say coronavirus is a disease that does not discriminate is wishful thinking. If you are poor, have had a life of income anxiety, poor healthcare, live in inadequate housing, and can't afford healthy food, space, and rest, you are vulnerable. Similarly, if you are a black or Asian medical professional, no matter how loved by your community and respected in your field. Given that the virus has already taken the lives of many people, rich and poor, I think the main thing that anyone can take away from this pandemic is that, in general, the older you are, the more vulnerable you are. I'm not saying that unhealthy food is good for your immune system in case your body needs to fight off infection, but simply observing government lockdown rules properly and avoiding sunbathing in public parks and going to Tesco's 3 times a week for food or goods you don't need is the right thing to do, whatever your race or background.